Okay, sorry about that. Okay, this is the way you do a secondary IV bag. Basically, I told you that the secondary IV bag needs 4 drops every 15 seconds. So what I'm gonna do is I hang it up. If you noticed, the primary IV bag has a blue clamp. Okay, that blue hook comes with a secondary line. That line comes with a secondary line of the IV bag of the IV bag. So it looks like something like this. It looks like that right there. Okay, so it's gonna come with that blue hook. Okay. So what I'm gonna do is take the secondary tubing that you see here. I'm gonna close my clamp. That's the most important thing. Close my clamp. What I'm gonna do is basically do this. Okay. I'm gonna close it. Make sure it's properly closed. Make sure your primary and your secondary is closed. Okay. Next, I want to tell you that you take this plastic thing here, and you open it, and you open your secondary IV bag. And you spike it the same way you do primary. You do the same way. Screw it on there, squeeze the chamber until it's halfway full. Okay? Then, very important step that I kind of forgot, and I don't want you to do this. All this here is filled with air. You have to get rid of the air. So what you're going to do is you're going to open this. Remember, it's open. You're going to take that, and you have to get all that fluid. You have to get all this fluid here. Okay, you have to get all the fluid. All the fluid has to drip. It has to go into the IV line. It has to drip here. The IV line, the fluid has to go from here to here to here until it reaches about right there. Okay, that's the idea. That's how you get rid of air. You gotta get rid of the air, or else you induce an embolism on the patient. So you open it. You open your clamp. Okay. I don't know if you can see it. Do you see it? See how it's slowly moving? I don't know if you can see it. Okay, hold on. Okay, so I'm gonna stop right there. You see how, I don't know if you can see this, the fluid is there. Okay, you can barely see it, please forgive me. Right there. See, that's the end of the fluid. You want that to go here. Okay, that's what you need to do. So you drip, 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 drip. Okay, until I'm gonna stop because this is medication. You don't want to spill the medication on the floor until it stops there. All the fluid has to stop there. Okay, close your clamp. Then close your clamp. Okay, then the way to do this is pretend this is an alcohol swab. Okay, this is the white port. Make sure the IV bag, primary and secondary, are white port compatible. We're gonna pretend this is alcohol swab. Okay, you take this is the white port. Okay, you scrub your hub, very clean. Okay, you scrub your hub, very important. You gotta do that. Then you take this guy. I'm saying, oh my God, what am I doing? You take your IV, your secondary IV line. You screw it on like this. You screw it on like this. Okay. Okay. Of course, this is going to be in your patient by now. It's going to be on your patient. It's going to be screwed into your central line or IV line. Okay. This is the main one. And now, since both clamps are closed, this is from the primary bag, and this is from the secondary bag. What you do is make sure both of them are closed. You open the secondary, okay, and now you use the primary to control the drip of the secondary. Use the primary clamp to control the secondary clamp, okay? So what you do is you open this and you calculate according 17 drops per minute or 4 drops every 15 seconds. So you do that, okay? You open your clamp. I'm just gonna open this. I'm gonna open this, and basically, okay, you see there's fluid coming out? Okay, I don't know if you can see that. And you calculate how many drops per minute. So 4 drops every 15 seconds. So you can just stopwatch and you measure 4 drops every 15 seconds with a primary clamp. But make sure that the secondary clamp is also open also. Secondary clamp has to be open and your primary clamp is closed. So now you control the secondary bag with the primary clamp. And you go like this. Should we drop? If you noticed, now if I open the primary, it will stop dripping. See how it's dripping? It's kind of full, see how it's dripping? Okay, so you calculate 4 drops every 15 seconds, and that's the way you do a secondary bag. Okay. If any questions, just let me know. Thank you so much. I wish I had better equipment. So if I finish school, I could get better equipment. Okay. All right.